Hello, everyone. I'm Kirsten Davison. I am a professor in the School of Social Work at Boston College. I'm also the Dean of Research here. Before I was at Boston College, I was at Harvard School of Public Health. Shine, we were really interested in children in the first 2 years of life, and clearly parents are play a very big role in the first 2 years of life. And so we really look at sort of the contextual factors, including parenting, that really may impact children's growth, actually, and then in turn their sleep. So there are a wide range of things that we assessed on the sort of contextual side of things. To show you the kinds of things that we're measuring, that we've included in the parent data set. So it's the things over here on the left-hand side, the contextual determinants. And so we have parent reports of a number of child characteristics, such as their temperament, various health measures. We have parent-child interactions around bedtime routines, soothing, limit setting, which we collectively refer to as sleep parenting. And then we've got a number of factors in the family, social, cultural, and the environment, including parental depression, father involvement. We have co-sleeping, neighborhood poverty, sleep location, light, noise, exposure. Actually, we've got a number of environmental measures there that may affect the sleep environment. In terms of, we measure, many of these things multiple times, which is great. So we have longitudinal data on this. We have data for both mothers and fathers. Fathers are a subset of the overall sample, but we recruited at least 150 or so fathers, and we followed them over time as well. And so you can really look at the interplay between parents. You can look at sort of their relationship with each other. You can examine how that changes over time, and then how it plays out in terms of children's growth and their sleep. As I mentioned, we have measured these constructs multiple points over the first 2 years of life. So this table really gives a nice indication of, the constructs you can see that are measured repeatedly, and the M is for the mother, F is for the father. So we have this family demographics, social determinants. We have mother's health information leading into pregnancy and during pregnancy. Both parents' health history, context, the parents' own health behaviors, you can see, are repeatedly assessed. Definitely their own sleep behaviors. And then we have things that also play into children's growth and development over time, including feeding practices with children, and then use of media and so forth. So it's a very comprehensive data set, and I think one of the real novelties about it is the fact that things are measured repeatedly over time. We have written a lot of papers, but I think there is much that could still be done with the data. And after putting so much work into collecting the data, it feels a waste not to have it used to its full extent, and probably, arguably more important in the current context where, people are having grants cancelled and so forth. I think it's really important to be innovative and creative in the data sets that we're using. So this would be one example of a data set that could really be useful for researchers at this time. I am all for data sharing. And I'm glad there's people in place like you and your colleagues that do all the work behind it, because that's the really hard stuff. That's probably one of the key reasons it's not done more frequently. And so, and this is a good, direction that NIH and so forth are moving to make data publicly available. And we all need to do it more. In terms of the parent side of things, it really places a large emphasis on parenting strategies around sleep, which is something that's not written about a lot and not comprehensively. There might be a question or two here or there, but we've got pretty comprehensive assessments of this and how it changes over time. So, based on that, I think it can really help inform direct recommendations for parents around sleep. and encouraging healthy sleep patterns in children.